This medical center in Dalua is the only one in the region, a lifeline for maybe 10,000 people displaced by Boko Haram troubles. Children are the biggest concern. Thousands of youngsters, like 2-year-old Samira, are suffering malnutrition. But here, there's help and hope and a chance of survival.
I felt like a handicap after Boko Haram attacked our village, burnt our houses, made away with our money and everything. I had nothing to feed myself or my child with. Thankfully, some respite is now coming. I have been bringing her here for treatment and she's been responding. But for the fact this medical service is free, I do not know what I could have done to my child by now. I may have just been carrying her corpse.
Samira is among the lucky ones. Many more children are cut off from aid because parts of the northeast are just too dangerous. The United Nations Children's Agency, UNICEF, says that nearly 50,000 children will die of starvation if they don't get food soon, and nearly 250,000 more are severely malnourished here in Borno State. There are 4.4 million people affected by the crisis, half of them in areas inaccessible to humanitarian agencies. Health workers are rising to the challenge, determined to play their part in keeping the sick and vulnerable alive.
We get about 400 to 500 patients of malnutrition daily that come from different communities. Although there are other cases that we deal with like malaria, typhoid, gonorrhea, hepatitis and other diseases, but the malnutrition is priority.
But they need more help from the international community.
Red Cross must come on drugs. We work here for 24 hours just to attend to any emergencies. We would be pleased if we got more food supplements and other medical aids from donor agencies.
The military have been pushing Boko Haram back, so it's only now that the full extent of the humanitarian crisis here is becoming clear. Children like Samira can be saved, but for all their heroics, local health workers cannot do it alone. Kelechi, Emekalam, CCTV, Maiduguri, Nigeria.